Hello everyone, welcome to another video with Fam Vanessa. So in today's video we'll be talking about cervical cancer. So cervical cancer is a type of cancer that occurs in the cervix, and the cervix is basically the lower part of the uterus that connects to the vagina. So it usually develops slowly, so it develops over time and is highly preventable and treatable when it's detected early. So this cancer is almost always caused by persistent infection with certain types of human papillomavirus infections. So it's a common sexually transmitted virus, and this cervical cancer is one of the most common cancers affecting women globally, especially in the low and the mid-income countries where screening and vaccination programs may be limited. So this is often a long precancerous phase where, like, the cervical cancer, it has this precancerous phase that is very long, and in this precancerous phase there is presence of abnormal cells called dysplasia which grow in the cervix. So these changes, they can be detected and treated before cancer develops, which is why routine screening is important. So, and which is why it's more common in places where, if they don't have access to this routine screening, is more prevalent there. So for the causes and the risk factors, the primary cause of cervical cancer is persistent infection with the high-risk HPV virus, like I mentioned before, especially types. There are different types of this HPV virus. There is the type 16 and the type 18. So the primary cause is when someone has a persistent infection with these two types, or either of the two types. So other risk factors include early sexual activity, multiple sexual partners, having a weakened immune system, smoking, long-term use of oral contraceptives, multiple full-term pregnancies, family history, like having a family history of cervical cancer, and lack of screening, either through pap smear or HPV test. So basically, the cervix is narrow, is the narrow lower part of the uterus. So this cervix, it has two main parts, the ectocervix and the endocervix. So the ectocervix is the outer part which opens into the vagina, and then the endocervix is the inner canal leading into the uterus. So the transformation zone where the ectocervical and the endocervical cells meet is the most common site for HPV related changes and developmental stages of the cervical cancer. So HPV, which is the virus that causes cervical cancer, it infects epithelial cells, and if not cleared by the immune system, it can lead to genetic changes and uncontrolled cell growth, forming tumors. So for the basic pathophysiology, the HPV infection, it enters the cervical epithelial cells through microabrasions. So in most women, the immune system clears the virus. However, in some people, especially the people with the risk factors that I mentioned, like lack of screening and having early sexual activity, all those things. So in people with these risk factors, the virus persists, and the persistent high risk HPV causes genetic mutations and changes in cell growth regulation. So this leads to precancerous lesions. So these precancerous lesions, they can progress over years to invasive cancer. So invasive cervical cancer breaks through the basement membrane, and it can spread to nearby tissues, lymph nodes, or distant organs. So looking at the symptoms of cervical cancer, So cervical cancer in its early stages, it may have no symptoms, which is why screening is crucial. As it progresses, symptoms may include abnormal vaginal bleeding after sex, between your periods, or after menopause. Then also you can see symptoms like unusual vaginal discharge, different from the normal vaginal discharge. And then there could be pain during sexual intercourse, pelvic or lower back pain, leg swelling. And leg swelling usually occurs in advanced cases with lymphatic obstruction. Then also urinary or bowel problems if the tumor presses down on nearby organs. So for the diagnosis involves a mix of screening, examination, and confirmatory tests. So number one, pap smear, which is also known as papinocolau test. So this detects abnormal cervical cells. Then we also have HPV DNA test. So this detects the virus strains, the virus that causes the cervical cancer. So it detects the strains of the virus. And then we also have colposcopy, which is the magnified view of the cervix for like closer examination. Then there's biopsy to confirm cancer if suspicious areas are seen. Then imaging like pelvic ultrasound, MRI scans, CT scans, they can be done for staging and assessing the spread of the cancer. Then staging is based on tumor size, lymph node involvement, and distant metastasis. So all these are various ways that cervical cancer can be diagnosed. So for the treatment depends on the stage of the disease, and it can include, like, for example, for the early stage, that is the precancerous stage or the microinvasive stage, there is something called cryotherapy that can be done. Then cone biopsy and surgical removal like total or partial hysterectomy can be done in the early stages. Then we have during the invasive cervical cancer stage. So surgery can be done for the early stages like removal of the lymph nodes or radical hysterectomy. Then radiotherapy too, using external beam, and then chemotherapy, which is often combined with radiation, and then targeted therapy or immunotherapy in advanced or recurrent cases. So for the general management of cervical cancer, basically ongoing care involves having regular follow-up visits, monitoring for reoccurrence, managing side effects of treatments like menopausal symptoms or bladder issues or bowel issues, and also trying to give emotional and psychological support to the patients, and then giving palliative care in advanced cases of the disease for symptom relief. So basically, for the prevention of this cervical cancer, the primary prevention is to get the HPV vaccination, which is ideal before sexual debut. Like, is recommended from the ages of 9 to 26, but it can be given later. So this HPV vaccine, then also maintaining safe sex practices like using of condom and limiting the number of sexual partners that you may have. Then that is for the primary prevention. Then for the secondary prevention, going for like regular pap smear or HPV testing. So if you are a lady and you are past the age of 21, it's good for you to be going for regular screenings like pap smear or HPV testing to know the condition or the state of your cervix, because early detection is better than the early detection is the best basically. And when you detect it early, you can start the early treatment of the precancerous lesions. So basically, in summary, cervical cancer is a preventable and treatable disease caused mainly by long-term infection with high-risk types of the HPV. That the HPV is the human papilloma virus, and if this cervical cancer is often has no early symptoms but can be detected through routine screening like pap smear or HPV testing, and when it's caught early, the chance of successful treatment is very high compared to when it's caught at the advanced stages or the late stages, because it's when it's at the advanced stages that you start seeing the symptoms like bleeding between periods and all those other things. So it's good that we know about this kind of conditions so that we can know how we could prevent them, how we could manage them, and just have general knowledge about it. So that is all for today's video. Thank you for watching. I'll see you in the next video. Bye.